medical expense department at SXM.
Okay, can you tell me what's the reason of the SV doing here?
Okay, we are here to give information about glasses and dental services.
That's the only thing.
Yes, those are the two things we have to do today.
So would you say that there is an increase in people need to wear glasses?
Well, there's an increase here, and there are people coming to us for glasses, and there are some that come, but they don't know exactly which entity is insuring the glasses, yes or no, and then we have to explain them that.
Well, during the mobile health bus drives, we usually come out as a department in order to assist with individuals who might be at the drive who do not have any medical insurance. So if you go through the actual application process with CPS and CPS representatives realize that you do not have any form of insurance, you can be referred to social services for us to assist you. In the event we realize, for instance, you're employed but you do not have insurance, so you have not been able to get that regulated, we would then refer you over to SZB, who is on hand today. Fortunately, they are on hand, but when they're not here, social services takes that information and then gets back to the individual and gives the necessary information that is needed by the person in order for them to determine which area they're going to go. But we are really here to assist individuals who have absolutely no way of getting any medical insurance.
Now, you talk about your system in what form or way that you assist, because there's all sorts of disease that they have that's in the medical area. I know there's certain areas that you all might not support, or you do support all areas.
The determination is made by SZB. SZB is the agent responsible for determining what is covered through the pay card. That's what we call it, the government pay card. And social services is just here to do the administrative part. So we get the applications in with all the required lists of documents, and the individuals in the department do the assessment based on laws and ordinances. So we actually revert back to the law. If the law indicates that the person qualifies, the person would be granted medical assistance. Then everything is processed and actually sent to SZB. SZB in turn provides a medical card that we disperse to the person in the community. But as far as covering and what the card covers, SZB is responsible for taking care of that.
Okay, my name is Jacqueline Wilson, and I'm one of the social workers at the Department of Social Services.
What does a social worker actually do from your department?
Okay, when clients have certain problems, or let's say for example they come in and they need assistance with a medical card, but in doing that assessment we notice that the client has more problems that needs attention, then they will be referred to me, and I will have a conversation with the client to see what really the needs are, and then from there we go on to see how to address those needs.
So do you go to the various districts to do that and homes? Or
Okay.
you just wait for people to come to you?
Well, it is a combination of, say, if I know my colleague caseworker states that this person needs assistance, I could always give them a call, do house visit, but we try to do as much house visits as possible when a client is not known to the department. And if there is any other information that is necessary, we try and get it from the client. So wherever the need is, we go to get the information.
And how long you been doing this social work?
Okay, I've been doing this for more than 10 years, but in St. Martin is for the past 4.5 years.
What are some of the experience that you went through in the 10 years that you've been a social worker?
Some of the experiences, well, they are different. Persons that need assistance when they are evicted from their home. Also persons that don't have medical coverage and need like a crisis intervention for a medical situation. It varies from all kind of situations.
Well, actually we are commemorating the World Oral Health Day. And I'm helping Irma Knives, that is the coordinator of CPS oral program. And I'm very happy. This is the third year that we do it. And we are doing checkups and basically orientation and checkup for the community. And I'm having a little bit of fun with the kids.
I noticed that the young fellow that you were just had his mouth open and looking inside to see his teeth. What are you actually looking for?
Yes, actually we are looking to advise the parents to if is there any problem, so we can stop it on time. And if the growing process is normal, then to orientate them. So how can they manage this? And also how they can improve the oral health of the kids, so they don't have the problem that we did have at that age. That is basically what we're looking for.
Okay, and then you have the father here with you.
Yes, that we have.
What exactly are you going to do to the father? You're going to pull all the teeth out? Or?
Hopefully not.
I know.
Hopefully not. Hopefully not.
You could go ahead and do your exam while I'm taping it.
So with the father, what we're gonna do, we actually with the adult, we ask if they have any questions, if they have any special consultation and orientation that they want, and if they have good. If they don't have it, we do a general checkup, and then if
basically-
they find something, we advise. If they don't find something, we put the thumb up.
I want to get it checked first, and then when I hear what I have, then I would like to know what I could do about it, because like things like plaque prevention, gingivitis, space in the teeth, maybe I have, because I had fillings before, so
Right.
I want to know if a filling drop out or what I could do about it. Maybe I have to rush to the dentist and get something,
Right.
seriously done,
Right.
Hopefully not. Hopefully not.
Would you like the idea of what the ministry department is doing that come
Oh,
out to the different
this-
district?
I ain't gonna lie, this is a beautiful idea. I really, really enjoy this idea. You know what I mean? Doing, the blood pressure, the AIDS campaigning, the dentist for sure. I just heard about that maybe like 20 minutes ago. My children never been to the dentist, so for it to happen basically a street over from me is luck, saves me money. I mean, I can't stop benefiting from this whole ordeal, I'm good.
How long do you think that it's going to take before you finish the hospital that you could carry out your program?
Well, the hospital's going to take a few years. We're hoping that before elections we can have figured out exactly what we need to build or who we're going to contract with. So we hope that before then we can sign an agreement for a turnkey developer to build a new hospital, but the actual design and engineering and construction will take a few more years after that. So I think you're probably looking at, honestly, probably 2.5 to 3 years down the road before we're ready with a new hospital. But in the meantime, we're making investments into the current hospital, trying to expand their range of services. We're also working with SZV to work on negotiating contracts for better contracts for patients that we're referring abroad. We're looking at, obviously Dominican Republic, Colombia, but also, for example, maybe Panama, Cuba, United States. We're looking at where we can negotiate the best service for the best price for the community.
As we're wrapping up this interview, what urgent message that you would like to send out to the public that's listening to your interview?
Well, I think we really want the citizens to be proactive in terms of healthcare in St. Martin. So we ask you, come out, come get tested. But even this goes back towards what we're working on with the Zika virus and the mosquitoes. We're looking at how do we reduce the breeding grounds and reduce the mosquito population, because the mosquitoes carry all kinds of diseases like chikungunya, dengue, and Zika. And again, we're really trying to mobilize the public, that the public participates in that process, because getting involved in terms of making sure your neighborhood is clean, making sure that you don't have water sitting where mosquitoes can breed. Government can't do everything. So really what's important is that we get the citizens involved in being more proactive about the health of the community, and through this, citizens need to be more involved in maintaining their own health levels. So the message to the people is get involved, be proactive in terms of making sure that we have a healthy St. Martin.
Need a loan that's quick and easy. Island Finance. Up to 50,000, give us real easy. Island Finance. For education, a renovation. That's no problem.
can afford what you crave, life just gets so good.
And I'm feeling good, so good, so good, so good. Hey, I'm gonna live my life, feeling good, so good, real good, so
KFC, so good for everyone.
GEBE has been faithfully serving the communities of St. Martin, powering your home and our economy. Come rain or shine, our qualified team of professionals are working hard 24 hours a day to provide you and your family with safe, reliable electricity and water. We use the latest technologies and test our products daily to maintain the highest international standards. Our friendly staff is always there to assist you, whether in person, over the phone, or online. We are committed to constantly improving our products and services, making them more efficient, effective, and environmentally friendly to serve you better today and our next generation of clients tomorrow. GEBE, powering a brighter future.
Our friend Mega Wadi is here with tips to save you energy. 1. Turn your airco temperature up. 2. Use a ceiling fan instead. 3. Buy energy-saving products. Save some green with NVGEBE.
Oh my, what an inventory list, and so unnecessary. But wait, your home contents are all insured by Be Sure. That means that you determine the amount you want to insure. No inventory list, no hassle.
Are you be sure? Be sure.
Hey Bob, you're on family vacation. Oh, but your daughter's got the measles. But don't worry about it. With your Be Sure travel insurance, children under 12 are covered for free.
Are you be sure? Be sure.
Yeah, for free.
Life is a journey full of connections. You're in safe hands even when life starts too soon. You don't have to miss a single beat. When a bad hair day makes you sad, just sharing can bring you joy and more to come. They take the plunge, turn fear into faith, while you capture those beautiful moments. In the game of life, it's family that counts. They'll be there even when you lose. We all have our moments of reflection and hope. And when you feel you're losing everything in life, we're there because there's more to come. When life starts too soon, you don't have to miss a single beat. We're here to connect you and share life. Telcel, when you want more.
I get ready. I ain't ready yet, but ready. I get ready like Bungie Gallin. You know we are doing now.
What kind of music are you going to play for the people now?
What the people want, whatever they want, I'm going to give them. That's my choice.
That's your choice.
That's my choice. What I play for who jamming.
So you're going to special tune out for this year?
I got tune there coming out there. Ain't no easy road for them. It's no easy road.
All right.
That coming up for them. That's the tune we're going to push tonight. And next week for the next job up, you get one or two, and then the party on. But you know me already.
I know you was on the French side.
Yeah, that was a blessing. First time, and we enjoyed. First time in our 15 years there, we enjoyed that job. But we gonna do, you know how we just do it.
Right.
It's Bigfoot in the crew, you know. This is NLB, you know. We never scared, you know. We going up full tractor, you know.
I noticed that.
It'll take a lot, and especially when you have everything when you're you know, and then you still got the technician there and everything, and things fall out, you gotta get in order. That does be a lot. Because imagine you see us only be there from 2 to 3 days ago, starting all this. To come today, we end up in a big problem. So, but that's the fun about Carnival and having a band. All them difficulties that make you strong, so the next time you come up, you start to get problems. But we're gonna be good. We're gonna be good. It take a lot of days and time and hours, a lot of stress. And when you're done, I just want to do is go home and drink some rum and lay down, you know, but you're too tired for that. So you just go home and sleep.
How many jams are you going to be doing for this year? Because I know you're doing the crossing one. Are you doing the Juve? Are you doing the parade?
For now, we only book for this one here. We ain't sure about the rest yet, but we only book for this one because you know we just go with the bands them here. With hell, we just get to get sponsors and this too. But we only book for this one tonight. The rest is yet to be seen, but we gonna know. look sharp, we will be there anyhow. You know we don't do it now.
Right.
You know we do it.
What
We
about
at
the
the
band
scale.
clash thing? Are you going to be in that too?
Yeah, we there. We the first one sign up for it because we never scared, so we ready to do any band clash you want.
So your team and everything is ready for that.
We ready for that. We ready like Bungie Gallon. I tell them we're ready. We ready. We don't waste time. We ready. All of them talking, but we ready for them. And we wanting them again. All of them coming. Small band got big shot. Tell them run with that. We coming. We there. We afraid of none. None. We afraid of none. The international, the over international. We even waiting on a band from Haiti say coming up for we. Because the name no limit too. So we waiting on them.
So far, so good.
So far, so good.
So far, so good.
All right, good, good.
Carnival, everybody.
All right, good, good.
been said that behind every door, possibility awaits. How much possibility depends on which door you open first. Every day, we help our customers discover the possibilities in their lives. It all starts with a conversation. Scotiabank. Discover what's possible.
In my opinion, everything is perfect and you would be great for the job. But I see here that there's a 2-year gap in your resume. What did you do?
I was hospitalized for mental illness.
Oh, mental illness?
I've undergone treatment and I have a wonderful family that supports me.
Well, that is good news.
No, it's fine. I'm recovered.
We'll contact you, okay?
For a better understanding of mental health and what you can do to stop mental health stigma, please go to the Mental Health Foundation's website at www.mhf-sxm.com.
But also the Taekwondo team, which had great success in Puerto Rico. The soccer team is currently right now in Aruba, and I think that lately more than ever we are seeing the successes of our youth being highlighted, not only in sports, but in the culture, the arts, and in education. And I encourage the St. Martin population to continue, as well as the business sector, to continue to support our youth who are going out there and representing St. Martin to the top of their ability and doing very, very well, despite coming from a very small island, still in the infancy of its development, where especially sports is concerned. Next week, we have 2 teams that will be going to Carifta Games, one in Martinique, the St. Martin Aquatic Foundation, that is swimming, and the Athletic Association will be fielding athletes to Grenada. So there again, we have youth that are going out there and representing the island, and I would like to encourage the population to support them in this. One area, I must say, I missed St. Martin Doot last week. I was sorry to have missed it during the weekend, as it is, I believe, one of the biggest volunteer initiatives that happens within the Dutch Caribbean as well as in the Netherlands, and it's a great initiative. But I would like to encourage volunteerism year-round. That's a one-weekend big volunteer session. But I would like to emphasize that there is much that can be done on a weekly basis within our schools, within our after-school programs, sports programs, and the like. And I would like to encourage that you give at least 1 hour per week, if you can handle it, to be able to assist our young people specifically, and the elderly also, to be able to have that interaction that they need with the general public and the encouragement that they need. So I do it myself. I volunteer once a week to do reading with the school. I would like to encourage all civil servants, as I was speaking with the labor minister, and there's a difference between the civil code and the general labor code, and so you'll have to hash that out in how we can encourage it in the private sector. But definitely in the public sector, civil servants, you are encouraged to at least volunteer, specifically 1 hour per week. I'm sure that your department and division heads will be happy to work with you in this. Of course, als de dienst het toelaat, you know how it goes. It has to be possible within our wonderfully busy schedules. And I still encourage business people, especially. A lot of parents are complaining that, schools are complaining that parental involvement is an all-time low. And because we are such an economy-driven society, many parents feel that they are in peril of losing their jobs if they have to go to their child's school once per week or even twice per week because of whatever the reason may be. But I would like to encourage the business community that the importance of parental involvement goes a long way in paying off the development of our community, and that we should encourage that, whether the laws say so or not.
Series of poker. The ministry, together with the Sonesta Maho Group, are collaborating in enhancing the gaming reputation of this destination and to bring in the forefront the position of St. Martin as a leader in this ever-growing market. It is the intention to align the Sonesta Maho Resort and Casino and the Tourist Bureau with the World Series of Poker, which is a poker game that since 40 years ago is in the making, and we are actually in discussion to attract this venue to St. Martin, where about 400 poker players will come to the venue and also attract more visitors and bring more income to this island. So as you see, we are very busy in trying to look into other niche markets so that we will not be only left with the seasonal and the hotels, but also other venues and organizations. I also met with a gospel group where I stated the last time that I was also looking into a religious tourism. And there is a group that is going to come on the cruise ship with 200 gospel singers, and it's going to be free, so we're going to organize that event as well.